So, good day po. I am Ricardo, Eirol, Lirio. I am your nurse for today. So, for verification purposes po, may I ask your name, birthday, and MR number? Okay, so for confirmation purposes, may I check your wristband? Okay, so today po, sir, I'm going to assess your genitalia po. The purpose of this po is to identify and reduce risk factors associated po with HIV, AIDS, prostate cancer, and testicular cancer. So, before anything else, should I be aware of any cultural sensitivity that you have po? Religious beliefs po ba yan? Or personal beliefs? Meron po ba? Okay, wala naman po. So, before anything else, do you want some privacy po? Should I close the windows, the curtains, and the door? Okay. Okay. So, now that we have secured your privacy now po, I will now do some infection control, which includes hand washing and the donning of my personal protective equipment. So, first po is the hand washing. There are 5 moments of hand washing. First is before touching a patient. Next is after touching a patient. Next is before doing a procedure. Next is after doing a procedure. And next is after being exposed to the surrounding of the patient or any bodily fluids. So now that we're done with hand washing, I will now don my personal protective equipment, which includes some fresh gown, some mask, some protective goggles, some hair cap, and of course some gloves. So let us assume that I have donned my personal protective equipment. Now I'm putting some clean gloves. Okay, now that I'm done donning my personal protective equipment, I will gather all of the equipments needed po in this assessment. Okay, so now that all of the things needed are within reach and gathered, I will now ask you po if you have any medical history related po sa inyong genitalia na hospital na po ba kayo dahil sa pananakit po sa may private part niyo po? Wala naman po. Okay. So you don't have any medical history naman po, medical records about your private or your genitalia po? Okay. So, in this assessment po, it is ideally po to make our client stand up while us nurses po is nakaupo para mas maayos po yung ating pag-assess sa patient. And pinaka-importante po dito is may consent po sa ating patient sa pag-assess po dito dahil ito po ay isang private part ng kanyang body and wala pong consent sa ating patient, we will not move on with the assessment. So, pwede ko po ba kayo assess in your genitalia or your private part po? Okay, so we can now start off po with the assessment. So the first part of this assessment po is the inspection of the base of the penis, which is this, and the pubic hair ng ating patient, which is dito po sa part na ito. So first po is the pubic hair. Ang normal findings po sa pubic hair is that it should be coarser or mas makapal sa kanyang scalp hair. And makikita naman po natin sa kanyang pubic hair na makapal-kapal naman po ang kanyang hair doon. While dapat po ang pubic hair po niya is nagko-cover sa entire groin, extending po sa may medial thighs niya po up to the abdomen towards the umbilicus. So makikita naman po dito na equally distributed po ang kanyang pubic hair. And that is a good assessment po. Next naman po is the base of the penis. The pubic hair or the base of the penis should be free of erythema and infestation and growth patterns. And mga masses po na pwede po mag-initiate ng penile cancer po sa ating patient. And of course po, as mentioned naman po kanina, okay po ang pubic hair niya. There's no absence or scarcity sa ibang parts, which is good. And we will take note of the pediculosis pubis po sa pubic hair and sa may base ng penis ng patient, since if may pediculosis pubis or yung also known as scraps, ito po yung mga lice or nit or infestation po na makikita natin sa kanya. And if meron po ganun, we will take note of that since that is a deviation po sa ating assessment. Next naman po is we will inspect and palpate the shaft of the penis. So ito po ang shaft ng penis po ng ating patient. So first po is the inspection. We will inspect po the skin of the shaft for rashes, lesions, or lumps. Dapat po is wala po yung mga ganon, since if meron po, that is also a deviation or pangit na assessment sa ating patient's genitalia. Okay lang po na wrinkled siya since may mga ugat-ugat po sa ating penis or sa may shaft. And dapat po is hairless din siya, and normally po talaga na there shouldn't be any rashes, lesions, and lumps na makikita. Since if meron po tayong makitang rashes, lumps, or lesions, we will take note of that since pwede po siyang ma-diagnose ng sexually transmitted infection or cancer. Next naman po is we will palpate the shaft for hardened areas or some tenderness po, since ang normal findings po sa shaft dapat po ng penis sa ating patient, if non-erect state po siya, dapat soft siya, flaccid, and non-tender. Since if there is tenderness po, it can be a sign of inflammation or infection. So we will use our index and our thumb in palpating the shaft. So permission po to touch. Okay, based naman po sa ating findings or assessment, there are no tenderness po tayo na feel. And since there is no tenderness po tayo na feel, it is a good assessment of the palpation of the shaft. Let us now move on naman po with the inspection of the glands or the head po ng penis nating patient. So, for inspecting of the glands po, we will make sure to inspect for the size, shape, and sa mga size and shape naman po, it varies po sa people. It can be round, broad, or pointed. And sa ating patient naman po, it is round naman po. And that is good. Next naman po is we will take note din po for some lesions or tenderness. And as we can see, as I inspect naman po, there are no redness and lesion, which is good. Next naman po is if uncircumcised po ang ating patient, we will ask him po to retract his foreskin to allow us to observe it clearly. Since circumcised naman po ating patient, we can inspect very well or observe very well the glands, and we don't need to retract it po para ilabas yung glands ng ating patient. The deviations po na dapat nating itignan or i-observe is the cankers or yung mga red oval ulcerations po na pwedeng makuha from sexual intercourse or wala pong proper hygiene, like syphilis or genital warts. And of course, the pimple-like lesions na pwede pong pagsimula ng herpes is pwede po siya makita sa glands, and we will observe for that. And nakukuha po yun ng isang person if he is sexually active, if hindi po yung safe yung kanyang pag-sexual intercourse, and if wala po siyang proper hygiene sa kanyang genitalia part. So, as I'm inspecting the glands, pinkish naman po siya. There is no redness, no lesions, no oval ulcerations then. So, ang glands po niya is clear from those deviations mentioned earlier, and that is a good assessment po. So, additional information po, if ang client po natin is not circumcised, dapat po ang foreskin po niya is easily retracted. And sometimes po, a small amount of whitish material called smegma normally nag-accumulate po siya under the foreskin. And the deviation po na dapat po nating i-look out po if hindi po siya circumcised is the phimosis, or ito po yung mga pagtatight ng foreskin niya na hindi po kaya siyang ma-retract. And the paraphimosis po, or ito po yung mga foreskin na once retracted is hindi na po siya na re-return to cover the glands ulit. Okay, so now let us now move on po with the palpation of the urethral discharge. We will do this po by gently squeezing the glands between our index fingers and the thumb. And dapat po ang normal findings dito is pag pinalpate po natin siya, the urinary meatus is normally free of discharge po. And if meron po siyang discharge like yellow discharge, it can be a sign of gonorrhea. And clear or white discharge, it can be a sign of urethritis. So, permission po to palpate your glands po. Okay. Okay, so based upon the assessment po or the palpation, wala naman po tayong nakitang yellow discharge or clear or white discharge na pwede po maging sign ng gonorrhea or urethritis. So that is a good assessment or good assessment of the palpation of the urethral discharge. Okay, so let us now move on with the inspection po ng size, shape, and position ng scrotum ng ating patient. So, ang scrotum po, it varies po sa size and shape and nagde-depend din po ito sa temperature. So, ang normal size po nating scrotum is 4 to 5 centimeters long, 3 centimeters high, and 2.5 centimeters wide. So, if through inspection naman po, makikita naman po na normal po ang size ng kanyang scrotum sa laki or sa laki niya and sa size ng kanyang penis. And trivia po, kadalasan po ang left scrotal sac po is mas lower than the right sac po or the right scrotal sac. And makikita naman po na there is no swelling, lumps, and bulges na dapat natin ikabahala sa may scrotum part ng kanyang genitalia. Since if enlarged po ang kanyang scrotal sac, it can be fluid, or it can be a blood, or bowel, or even tumor. Kaya if meron po tayong makitang enlargement, or even swelling, we will take note of that po as well. And there's also po the enlargement of the veins po within the scrotum, also known as varicocele. And nagkakos po siya ng low sperm production po and decreased sperm quality po sa ating patient. So, we will also look or observe for that since pag meron po, i-take note po natin yun. So, next naman po is we will inspect the skin of the scrotum for its color, integrity, and presence of lesions and rashes if meron po ang ating patient. We will also palpate the scrotal content, which is the testes and the epididymis, between our thumb and the first two fingers. We will take note for the size, shape, consistency, and presence of tenderness or nodules. We will palpate it po, noting for some nodules again, swellings, and tenderness. For a proper or accurate inspection naman po, we will spread out the scrotal folds of the skin and we will lift the sac to inspect the posterior skin po. So, we will palpate and inspect. First po is yung pag-spread to inspect. Okay. And the palpation. Okay. So, based naman po sa assessment, ang kanyang scrotal skin is within normal. Since ang normal findings po dapat sa scrotal skin nating patient is dapat thin, rugated, and or crinkled with little hair po. And its color naman po is slightly darker po than the other parts of the penis, which is darker naman siya. And there are no signs of lesions and rashes. And trivia po, a sebaceous cyst or yung mga small yellowish firm non-tender benign nodules po sa may scrotal part na ating patient is a normal findings. Dapat wala po tayong kabahala doon. And next naman po is doon naman po sa pagpapalpate natin kanina sa kanyang testis and epididymis. Ang testis niya po is approximately 3.5 centimeters long, 2.5 centimeters wide, and 2.5 centimeters deep. And equally bilaterally in size naman po ang kanyang size and shape. And ang kanya pong nung pinalpate po natin ang kanyang scrotal content, smooth, firm, and rubbery naman po ang kanya, which is a normal findings. Free of nodules din po siya. And epididymis naman po is non-tender and smooth, which is good. Let us now move on with the inspection of the patient's inguinal and femoral area. And dito po, we will watch for some masses and bulges. Since if meron po, it can be a sign of hernia. And if meron po nun, we will take note of that. So, let us inspect po. Okay. And wala po sa checklist, but we can palpate for the femoral hernia po natin patient in front of the thigh in the femoral canal area. Since sa pagpapalpate po na ito, we will ask him to bear down or cough while feeling for some bulges, and we will do it po both sides. And we can also do that po to assess if there are bulges or signs of hernia. But from the inspection naman po natin kanina, there are no signs of bulges and masses sa kanyang may inguinal and femoral part na it can be a sign of hernia. So, which is good since bulges appears at the external inguinal ring po or at the femoral canal when the clients bear down. So, since wala naman po tayong nakita or na-observe, that is a good assessment po ng kanyang inguinal and femoral area. So, let us now move on naman po with the assessment of his anus and rectum po. First po is the inspection of the perianal area. Dito po inspect po natin if there is lesions and lumps. Like, for example po is warts. Since if meron po, that is a condition na dapat po natin ikabahala and we will take note of that po. So, as we inspect po sa may perianal area, okay, so there are no lesions and lumps naman po tayong na-observe. No warts na dapat ikabahala, and that is a good assessment po. So now po, let us now inspect the sacrococcygeal area. This includes po the anus and the surrounding skin. We will check po if there are soft tissues for cysts, if meron po siyang fistulas, and external hemorrhoids. Since if meron po, we will take note of that po as the patient's condition. So, as we inspect po the sacrococcygeal area, wala naman po tayong dapat ikabahala. There are no cysts, no lesions, no lumps, no external hemorrhoids na dapat nating take note, which is a good assessment of the sacrococcygeal area. Next naman po is the palpation of the anus. And in palpation of the anus po, we will give attention po sa mga presence of masses, tenderness, hemorrhoids, fissures, ulcers, and the color of it po, and the consistency po ng kanyang anus. Since if meron po tayong feel na mga ganitong deviation, it can be a condition po na dapat po mat-treat agad ng ating doctors. We will take note if he is sexually active and there is a sign of warts din po sa may anus. So, palpation using our fingers. So, permission po ulit. Okay. Okay, we will palpate it now. Okay, so that is a good assessment po since wala po tayong na-feel na mga masses and wala po tayong nakitang warts. There is no tenderness din po. It is in a good consistency, and of course wala din po tayong nakita mga hemorrhoids, fissures, and ulcers, and that is a good assessment po. Next naman po is the palpation of the rectum. And since nasa palpation na po tayo ng rectum, isasabay na po natin ang pagpapalpate ng kanyang prostate. In the palpation po ng rectum, we shouldn't feel any nodules or masses po dito or tenderness. Since if meron po, that is a sign of a condition like prostatitis, and we will take note of that as well if meron man po. So we will use our fingers in palpating the rectum or the prostate. We will use our index fingers, and since ipapasok po natin siya sa may anus, we will use some lubricant para po hindi po masyado masaktan ating patient. So we will now put some lubricant. Okay, so we will now patient, I will now insert po my fingers to your anus up to the rectum to inspect or palpate po your rectum and your prostate glands. So, permission po. Don't worry po, there's a lube po dito sa aking hands para po hindi po kayo masyadong saktan. And this won't take a lot of time po para hindi po kayo ma-feel uncomfortable while I do it. Okay? So, game po. Just take a deep breath. Okay. Okay. So, approximate size po ng prostate gland, normally po, it is the size of a walnut. So, 2 to 5 centimeters po siya. But, wider po siya at the top. So, normal naman po ang ating pagkakapalpate sa rectum and sa prostate gland sa ating patient. As mentioned po, there are no nodules, masses, and tenderness in the field. So, wala po dapat tayong kabahala. And, normal naman po ating palpation for the prostate glands. And, wala pong any enlargement sa kanyang prostate. And, wala pong inflammation. So, that is a good sign po na wala po kayong prostate cancer. And, overall, a good assessment for the palpation of the rectum and the prostate gland. Last naman po is the palpation of the peritoneal cavity. We do this po by placing our hands, this part of our hands, flat po on the abdominal wall na ating patient and applying firm and steady pressure. And mas helpful po if we use two hands in palpation po like this. And it is much more helpful if we use both our hands in palpation and in this position po like this. So in this setup po, yung nasa taas na hand, ito po yung nag-exert ng pressure. While yung nasa bottom po, ito po yung nag-feel ng mga masses or tenderness sa may peritoneal cavity niya po. So we will do this po. Papahigayin natin ating patient, and if meron po tayong ma-feel na tender sa area po ng kanyang may abdominal wall, it can be a sign po ng lipomas or hernias, and we will take note of that po, since that is an abnormality or irregularity ng kanyang peritoneal cavity. So we will now ask the patient to position himself in a supine position, and we will now palpate it. Okay? Okay, so based naman po sa ating palpation, there's no irregularities and abnormalities sa kanyang peritoneal cavity. There's no tenderness, no sign of masses, and patient, may mga sakit po ba while I palpate your peritoneal cavity? So, wala naman daw po na feel na pain ng ating patient, and wala naman po ako na feel na swelling and masses sa kanyang peritoneal cavity, which is a good assessment po ulit ng kanyang peritoneal cavity. So now that we're done with the overall assessment, I will now document all pertinent information na important po sa ating nursing po. Next po is I will dispose lahat ng ginamit po natin sa appropriate bin. Okay. And then, lastly po is I will discuss the holistic nursing care, which includes, sir, not only your physical aspect po aming bibigyan ng care and focus, but also your physical, your social, emotional, spiritual, and psychological aspect. So, always remember po na nakafocus po kami in giving care and pagpapagaling to all of those aspects. So, thank you po. So, thank you po for your consent, your time,